Okay, we're at 10 a.m. and I have started the recording. So panelists, please feel free to start.
All right, well, good morning, everyone, and welcome to our We Love Our Volunteers gathering today. It's really a wonderful day to get together with each and every one of you. I'm Tom Koutsoumpas. I'm the president and CEO of Capital Caring Health, and it's such an honor to serve in that capacity. I'd like to start our meeting, which I like to start all of our meetings, with reminding us of who we are and what our mission and vision is. Our mission is to provide patients and their families with advanced illness care of the highest quality. Our vision is to be the best provider of advanced illness care and the best place to work in healthcare. Our core values, which are so important and reflect who we are: patients and families first, always do the right thing, and respect everyone. I am just so pleased to be with each and every one of you today. It's a great honor and a great pleasure. I want to share the appreciation of not only myself, but of our board of directors and the entire leadership team for all of you that you do to care for our community, especially during this difficult time. As I reflect on this past year, one of the most challenging years, of course, that we've ever had, we have had our best laid plans put aside to deal with COVID-19. I really can't tell you how proud I am of each and every one of you for all the work that you're doing to help us stay the course. Your leadership team have shared so many stories of compassion, extraordinary service that all of you have provided throughout this pandemic. When the face-to-face visits had to be canceled due to the COVID-19 restrictions, you worked to quickly find new ways to reorganize and stay connected with our patients and families. Just a few examples that I want to highlight because it's just so extraordinary and so meaningful to each and every one of us. Sewing and distributing masks, caps, and gowns, which provided the much needed PPE for our staff when we could not acquire these items from suppliers. That was one of our biggest challenges, as it was for many healthcare companies across the nation, but you made it possible for us to continue. Facilitating Zoom calls, which like we're on today, which we've all gotten used to, and I'm always enjoying seeing the dogs and the kids and other interesting things occur during these Zoom calls, so I welcome that today as well. But we've gotten used to that. It's become part of our life. Sending calls, or cards, I should say, and letters to our patients. Producing a very special Veterans Day recognition program to honor our patients who are veterans. Creating handmade cards, bracelets, and keepsakes. Delivering flowers and packages. Recording videos of prayers, poems to share with patients and families. Providing important tuck-in calls to check in on patients and make sure that they have what they need. You know, one of the biggest challenges during this period has been social isolation. The isolation is occurring so many other illnesses, such as mental health challenges, depression, and loneliness. And you've absolutely, with your work, have made sure that doesn't happen with the patients and families at Capital Caring Health. Volunteering with masks and social distancing in our thrift store, which has continued during this entire pandemic. And then there are just so many other wonderful examples of how you all have stepped up to serve the communities nonstop during this extraordinary crisis. Your commitment to our mission is unwavering. Our team of more than 1,000 volunteers are the backbone of Capital Caring Health's hospice team. And in 2019, listen to this, you provided more than 58,800 hours of service. 58,800 hours of service. I am just so proud of the recognition that you've received this year, being named the 2020 Volunteer Program of the Year by Volunteer Fairfax. Let me repeat that. That's such an honor. 2020 Volunteer Program of the Year by Volunteer Fairfax. What a tremendous accomplishment, and I really couldn't be more proud. And one of our own volunteers, Sabra Poimbuff, who's an active duty service member in the United States Navy, was named Volunteer of the Year. What a great accomplishment. If we could, I think we can, let's give her a round of applause. What a tremendous, tremendous accomplishment, and congratulations. Really proud of you and proud to have you on our team. We simply could not exist without all of you, our exemplary team of volunteers. You really are the heart and soul of Capital Caring Health. And all of you are making such a profound and positive impact on our community, on our patients, and on our families. It really is more meaningful than I could possibly say. So for me to be here with you today and to make sure that you know how we feel about each and every one of you is really such an honor for me, and one of the most important moments for me personally. So now with that, I'd like to ask Rachel Weaver, our new Director of Community and Volunteer Engagement, to share a special message with you. And Rachel, a special welcome to you as well. We're thrilled you were with us before, and now you're back, and we're really thrilled about that and thrilled to have you leading our efforts with this. So let me turn it over to you.
Thank you so much, Tom. I appreciate that. And we appreciate your leadership and your time today to recognize our amazing volunteer team. We might be a world on lockdown, but Capital Caring Health, if you believe it, has more active volunteers this year than last year. You range in age from teens to the 90s. You speak many languages. You come from many nations and states and neighborhoods. And you are a beautifully diverse group of people who are united in your caring. You care in many ways. You sew, you sing, you play instruments, you make cards, you write cards, you honor veterans, you are veterans. You make phone calls, you make deliveries, you arrange flowers, you put together packages, you celebrate birthdays, you ensure holidays can be happy times. You scan and file documents, you stuff envelopes, you answer phones, you build relationships with patients and families, providing a loving support system in their time of need. You also donate money, time, materials, and more than likely blood, sweat, and not a few tears. Being in your presence today, even virtually, I am in awe. I've had some wonderful conversations recently with your community and volunteer engagement team. And although we also are a diverse group, we all agree that the reason our programs are effective and beneficial to patients, families, and staff is because our volunteers want to give back. They care about the impact they're making, and they work hard to use their skills to help others and genuinely care about patients and families. You have the chance every day to bring warm, happy moments and memories into very difficult times. You make a difference every day simply because you want to. You care, and you have the strength, courage, and heart to care for hospice patients and their families and the Capital Caring Health staff. We feel that caring, and we thank you for it. And I want to take a moment to introduce one of our managers of community and volunteer engagement, Catherine Noble. She's the manager of the Alexandria neighborhood, and she has a few things that she's going to say to us. So make sure that you unmute, Catherine.
Okay, thank you. Thank you, Rachel, and welcome. We're glad Rachel's with us. My name is Catherine. As Rachel mentioned, I am the volunteer manager of the Alexandria region. And I want to take a moment today on behalf of my colleagues on the engagement team to say thank you, a heartfelt thank you to all of you. If you could, sometimes if you have your ears itching, it's probably because we're talking about you in a very positive way. We like to share those stories of successes. They're your stories and they're our patient stories. And they're so meaningful. As Tom mentioned the word connection, it really got my mind thinking, because that's what we strive for, and that's what volunteers provide, meaningful connections. And we do that by person-centered care, starting with our social workers who know our patients from day one, and the nurses. And then they come to us and say, here's the situation. How can these amazing volunteers help? And you all don't hesitate. Just recently, I wanted to share a little story with you because it really embodies some of the things that every volunteer does. So our social worker came and said, you know, I have this patient, he's in his 50s and he really needs some extra TLC. Well, we're in the middle of a pandemic. We have that barrier, but that's okay. We can overcome that. There were a few other barriers as well. He did not speak English. He also was living in a homeless shelter. As you know, we proudly take care of everyone. We do not turn anyone away based on their inability to pay. So the social worker and the volunteer team got together and said, well, what's meaningful to this patient? How can we have that meaningful connection? And what we realized is that, you know, although the homeless shelter provides meals, they're not a meal of choice. So what we did was our volunteers got together, about 9 volunteers got together, and they started to use our language line and call the patient and gave him the gift and the dignity of choice so that he could choose 1 or 2 or 3 items from the grocery store. And our volunteers then went and got those items and brought them to the homeless shelter. Can you imagine how meaningful that is? We all know how we feel when we're not feeling that great. You get, you know, a craving for certain foods. So this gentleman has been provided that gift of choice. And we consider that a very dignified approach to our care. And that's what our volunteers are providing. I know you all have tons of stories. They're your stories of meaningful connection. And we thank you for those because it allows us to do our job and our social workers and our nurses. We really appreciate you. And we hope that you know, especially this year, thank you for breaking down those barriers of the pandemic and all the deliveries and everything that you do. It's just so joyful to be a volunteer manager at this company. We appreciate you. We wish you all a happy holiday. Thank you. Please share in the joys and the successes in your stories. We thank you.
Thank you so much, Catherine. That was beautiful. You are amazing, as are all members of our community and volunteer engagement team and our volunteers. And we have a few volunteers who are going to share their thoughts with us today. So allow me first to introduce Maya Adams from our Maryland neighborhoods. She is an intern who's been providing amazing administrative support for just 4 months, from August through November this year. She gave already almost 500 hours in those few short months. So we look forward to hearing from Maya. Maya, if you would turn on your camera and unmute yourself and share with us your thoughts today.
Okay, hi everyone. I'm trying to turn on the camera. I can't seem to find that. It
Should be
doesn't.
right next to the mute button, Maya.
Yes, that's what I'm seeing. It's just the mute button.
I wonder if, because of how we have things set up, Amy, or is the video not possible without your help?
I am promoting her to panelist. Give me
Thank
just a
you,
moment.
Drake.
Excellent. Thank you.
1 second. Okay, I think that it should
There
be.
you are.
All right, and you're
Hi.
beautiful, please.
Hi. Hi everyone. First, I just want to say I really enjoyed my time with Capital Caring. And a fun fact, both of my parents were in Capital Caring, so that's part of the reason that I ended up volunteering, and you guys also helped me graduate. I'm graduating on Sunday, so I just
All right.
thank you guys for giving me the opportunity.
Congratulations.
Congratulations.
Before I leave University of Maryland College Park.
Excellent.
I had such an amazing time. I did not know that I could have such an impact on people in 4 months. It got to the point where my patients were waiting for me on Thursdays to call them, and it was just a great feeling to like know that they were literally waiting for me to like just talk about their day. Like the first few calls went from, oh, okay, I don't need any medicine, to, oh, okay, well, how are you doing in school? And then my granddaughter is graduating too. And like, I learned so much about their families, like beyond just them and the patients. And the caregivers, when I called them last week, it was my last week, and they were very sad, and they all were just like, I'm so sad to see you go. I wish that you could just call, for the rest of the year. And I'm very sad to leave you all as well. But I did say that I will volunteer again next year, outside of my internship. I will be back. I plan on coming back at least once a year to volunteer with you all, just because of the experience I had, and everything that you all did for both of my parents. My father was in Capitol Caring in 2016, and my mom just left Capitol Caring, passed away in 2020 in August. So I'm just beyond grateful for the program. I feel like even though it was virtual, my patients and their caregivers really appreciated knowing that I was able to volunteer and help them. And even with the social isolation, as you said earlier, it was really important to make those calls and be able to give them a human connection. A lot of them were like, well, when are we going to be able to meet you? And I'm just like, oh, COVID and everything. But I will continue to volunteer until hopefully one day I can, be face to face again with my patients. I really want to get that experience as well. But it was a very fulfilling experience, and the 500 hours did not feel like 500 hours at all.
Right.
So I'm just so grateful and very humbled to be on this call and to meet you and everybody else, Miss Rachel. And it's just a very, very, very great experience. So thank you all.
Thank you so much, Maya. Wow, you are
Yeah.
such an inspiration.
Absolutely.
Congratulations.
Thank you so much.
Our thoughts and hearts go with you at your graduation, and we look forward to you coming back to volunteer soon and often.
And
Yeah.
soon and often. Absolutely.
That's right. 500 hours is a lot, but we want more because we're greedy and we
That's
love you.
Thank you, Maya. Tremendous.
No problem.
So allow me now to introduce Mark Smith, who's a volunteer from our Alexandria neighborhood. He has been volunteering with us for about 4 years, doing tuck-in and patient and family care, and he gives about 100 hours a year. And those are hours that we need and we very much appreciate. So Mark, we turn the time over to you. You can unmute, and I think you should be able to turn on your video as well.
I'm able to unmute. How do I turn on the video again?
Great. Why don't we do the same thing with Mark here so we can make sure and see it.
Thanks. I appreciate your help.
No. Drake was working on it, but I think that he was making sure he had the right person. So you should be able to start your video momentarily. There you are.
There we are. There's Mark. Anybody?
Good morning, everybody, and it's a pleasure to be with you today. This is especially meaningful to me. I've had the pleasure to work with Tom Koutsoumpas for more than 20 years.
Exactly.
When Tom was government relations vice president for VITAS, I worked on the Hill for Senator Connie Mack from my home state of Florida. He was on the committee that had jurisdiction over Medicare and hospice policy. And hospice policy was one of his top health-related priorities. Tom became a trusted and valued resource to the senator and me to advance policies that benefited hospice patients, their families, and caregivers. And so, Tom, it's great to work with you again in this new capacity.
Absolutely, Mark. Thank you.
On behalf of my fellow volunteers, let me first express our sincere appreciation to the management of Capitol Caring for the unwavering support that they have given. They truly understand that volunteers are an important component to the multidisciplinary care that we provide to our patients and their families. And in Alexandria, we could not have a more effective, compassionate, and motivated team leader than Catherine Noble. Before COVID, we used to be able to visit our families in person and build lasting relationships. We provided respite care to ease the family on burdens. We brought flowers and other gifts to brighten their days. And sometimes it was something as simple as sitting with them, our patients, hold their hands, listen to their fears, their concerns, and provide hope when it was desperately needed. We coordinated with the Capital Caring medical team to identify and provide services to help provide the highest quality of care to patients. And this not only includes their physical needs, but also the psychosocial needs of patients and their families, which are so important. Since COVID, we have launched new contact-free programs for our patients and their families, and we now do visits with patients through Skype and other video conferencing methods. Our volunteers have made and delivered masks and other PPEs and have continued the work that we've done, but just moved to a contact-free method of doing it. One of the most beneficial has been tuck-in calls. We contact about 30 patients each every week by phone. And we ask how the patient and their families are doing and make sure they have everything they need to care for the patient. We also built in a quality care assessment question, such as making sure that they have information on the medications that they are given, potential side effects, that kind of thing, their psychosocial needs, their satisfaction with the care that we are providing. And we then alert our care team of any supplies that they need or anything that we can do to be helpful. And, you know, this proactive approach has been greeted by our families with and our patients with overwhelming thanks of support. And we also get to have fun. You know, we got together, we made masks, we made PPEs. This week, for example, we delivered dozens of Christmas stockings made by volunteers to patients with goodies to eat and crossword puzzles and books and other things to make them happy. And we also deliver flowers and small gifts to them. And we can do this, you know, contact-free. None of the work that we do, however, would be possible without the tremendous support we have received from the management of Capital Caring. They have provided us with everything that we need as volunteers to be able to help them and the entire team to make sure that we are meeting all of the needs of our patients. And it is just an honor to be associated with a dedicated, compassionate, and skilled team of professionals.
Thank
so
you, Mark.
much. Yeah.
Rachel, I would just like to comment a minute, Mark. Thank you. Mark and I have known each other for many, many years, as he said, and he's very humble. When we first started developing the Medicare hospice benefit, Senator Connie Mack was one of our most important champions. And it was Mark that always made sure that everything was working. We were working together, we were advancing it and getting it done. And so your engagement for all those years, Mark, is really one of the reasons that we're able to do what we do today. So having you now as a volunteer is very special, but I just wanted to remind folks of the important role you played in developing the benefit. So thank you.
Well, thank you, Tom. And I'm sure that Senator Mack would want me to join in commending all of the outstanding work being done by Capital Caring Hospice.
Thank you so much.
Thanks, Tom. And thank you so much, Mark. Isn't it nice when all the parties appreciate each other and work so well together? And also we love that the hard work you do is also fun. And that's what makes you and all of our volunteers so special.
Yes.
So let me introduce another special volunteer, Ellen Malka from our Manassas neighborhood. She started this June in the midst of the pandemic and has already given 100 hours of service. She does tuck-in calls and friendly calls and really makes a difference. And we look forward to hearing from you, Ellen, if you will unmute yourself. And I think we've got you permission also to start your video.
Okay. There I am.
There you are. Hey,
Good
Ellen.
morning, everyone. I
Hi.
was kind of worried it wouldn't work because this is a different Zoom configuration. I'm glad it's working. So I actually started, I met Roxana, I believe, on March 11th. And what originally brought me to Capital Caring was I was interested in the Heroes Bridge and some horse therapy programs that Capital Caring is involved with. But then 2 days later, the restrictions started, right? And there's two important things, actually three important things I want to say. The first is I really want to compliment Roxana. She's a wonderful director. She has this beautiful blend of humor and pleasant demeanor and effective administrative skills. You know, it's really unique. And she is able to set up a good communication just all digitally. You know, we've only seen each other once, but I feel like she's my friend. And the other people that I feel are my friends are the patients that I call and the caregivers. And it's amazing how much I have learned from them, even in their final days of life. You know, they have lessons to share with us. Every day is important. Even the dementia patients, sometimes the most profound statements come out of their lips. It's just amazing. They have these moments of lucidity, and it's very revealing to us on what is meaningful in life. One of my most favorite memories is one of my patients who passed away was telling me about frog jam. And if, for those of you who don't know what frog jam is, you can Google it. But it was, I mean, we used to have lots of fun conversations about simple things like that. But I'll always think of him when I have frog jam. And the third point I wanted to make was, it isn't just about the good that we do for the patients, but it's what the patients do for us and the whole organization. Because of medical, past medical history, my husband and I are on very strict restrictions. So, you know, we have barely left our property except for essential chores. And this is a connection for me. So it isn't just how am I helping as a tuck-in caller, but it makes me feel like there's, like Maya said, her patients were always looking forward to her calling them. Well, I look forward to calling my patients because it gives me a sense of purpose. So, you know, Capital Caring is a wonderful organization, and I feel very blessed to be part of it. And I just love being able to communicate with Roxana.
Oh, that's wonderful, Ellen. Thank you so much.
Mm-hmm.
It's tremendous. And
Yeah,
how beautifully said. I think, you know, people often say to me, how do your staff do it? How do they deal with this every day? And my answer is always, actually, it's a gift to them. The opportunity for them and the importance that they feel of the interaction with these extraordinary people really lifts their spirits and lifts them as people. So it really is a gift. That was beautifully said.
Thank you.
beautifully said. You're the perfect example of flexibility and dedication no matter what gets thrown at us. So thank you for your grace and all your support. And everybody, don't worry, frog jam is not made with frogs, and it is indeed delicious. So what we are hoping to do next is, anyone who's comfortable, we want you to turn on your cameras so everyone can give us all a wave and applaud each other, and we can take a group photo to commemorate this occasion. So I think Drake is working in the background to turn on everyone's ability to turn on their cameras. We're going to take this screenshot. So if you turn on your camera, then it's your permission to have that picture taken. And that's only if you're comfortable and camera ready. So don't worry if you're not, you don't have to. But Drake, do you want to let us know, is everyone ready for that? Or shall we wait a moment and let Tom say a few more things first?
It's going to take some time. There's just about 60 attendees. Give me a few moments, Tom, if you want to say some wise words.
Sure. Well, thank you, Drake. I'm not sure how wise they are, but I'm happy to say a few words. And, you know, Rachel, I want to also thank our leadership, our staff, the volunteer coordinators, again, all of the work that they do. And as Ellen was describing, their work is so meaningful as well. So I want to make sure that we recognize them for the extraordinary work that each and every one of them do. As I was saying earlier, you know, I couldn't be more proud of all of you this period of time, which has been so extraordinarily challenging, in light of that, we've really not missed a beat. We've not had any missteps with respect to the ability to innovate, to adapt, and to make sure that we continue to engage with our patients and families and with our staff and each other. We've been very careful, as you know, with respect to making sure that we did all the appropriate protocols so that our staff is protected. I'm proud to say that that has been an ongoing successful effort. We're thrilled, of course, that the vaccine is coming soon. We hope in the next couple of weeks we'll begin to have access to it for Capital Caring Health. But in the interim, we've been able to manage through this whole process. And I think in some ways, really, as Mark was saying, through adapting to new approaches, have been able to maybe even communicate more with people, recognizing the desperation, the isolation, and the things that many people are feeling alone. So again, it's a tremendous accomplishment for us, for each and every one of you. As we close out our 2020, I just can't thank you enough. I also maybe thought we could talk a little bit about our future. People often say, sort of, what are we doing? How are things going into the future for Capital Caring Health? I think, as many of you know, and as Mark mentioned, we're the oldest and one of the most experienced hospice organizations in the nation. We started as the Hospice of Northern Virginia. We have the oldest inpatient unit in continuous operation at Hallquist, and we're very proud of that. So we continue to lead the way in providing the highest quality care throughout our service area, but also set an example to programs across the nation. In 2021, I'm so glad we're about to leave 2020. In 2021, I think it's going to be another year of exciting accomplishments. I'm just going to highlight a few exciting things that are coming forward that I think you can get excited about. We've created a wonderful partnership with Johns Hopkins Health, and we're opening our inpatient unit at Sibley Hospital, the first that Johns Hopkins will have opened. And that, I'm proud to say, is under construction as we speak. There was a little bit of a blip of time because of COVID, but the construction is occurring, and we hope that we will be able to open that this summer. We're thrilled about that. We also have just established our lease at the Providence Hospital, so we can continue serving in Northeast Washington, and we're thrilled about that and partnering with the Ascension system. We have a new program we're launching next month that's focused on cardiac care that we think will be one of the most significant impacts for heart patients in the nation. We're partnering with the American Heart Association. It's the first such project in the country, and we're really thrilled about that. Heart patients are the most underserved patients for hospice and end-of-life care. So we're really taking that on, and we're thrilled about that. We continue our efforts to expand access to hospice and advanced illness care in underserved communities. And we're really proud to say that we're working on developing a project in Ward 7, the most underserved community in Washington and one of the most underserved in the nation. We're going to be introducing our home-based primary care as well as hospice services, establishing an office in Ward 7. And the District of Columbia, who I met with just a few days ago, could not be more thrilled. So we're going to highlight that as a model for the nation and hope that others across the country will begin to do the same thing to make sure that no matter where you are, no matter who you are, that you'll have access to the very highest quality care for people with end-of-life needs. So we're really excited about that. We're continuing to look at other ways to innovate in our communities across the nation, our veterans program. I don't know if you saw the Channel 9 segment just the other day about our children's program, but if you haven't seen it, Steve, if we can make sure people get access to that clip, it was extraordinary. We are one of the largest providers of care to children who have advanced illness and who are terminal. And so we're really, really proud of how that program is continuing to develop. So those are just a few of the things that I wanted to highlight that I'm most proud of, and I know all of our staff is most proud of, and I know you are as well. And one last thing that's kind of fun. I got a call recently from a guy who claimed to be working for Dennis Quaid. Many of you know who Dennis Quaid is, the actor. And I thought it was a prank call. I wasn't really sure even sort of what to say. I called Steve Cohn, our head of communication and philanthropy, and I said, Steve, I just got this call from a guy who said he is working with Dennis Quaid, he's his producer, and they've chosen Capital Caring Health from all of the organizations across the nation, and they'd like to come and film a day and highlight us on their program called Viewpoint, which is an important program on PBS. Well, in fact, it was all real, and Viewpoint and the PBS folks are coming to Capital Caring Health in January to highlight us as one of the most important innovative programs in the nation. So stand by for that. We're excited about that. We can't wait for you to see it. And millions of people across the nation will be able to see what we do here at Capital Caring Health. So all of that is so important. And none of that would happen if it weren't for all of you, the amazing volunteers. One last thing I was going to say, which I think is really underscores how important you are. When we were developing the Medicare hospice benefit in 1982, and some of you have already heard this, I was one of the authors of it and worked hard with folks like Mark and Senator Mack to establish it as a Medicare benefit. Before that, it was a demonstration, it was an idea, but we were able to get it passed into law. It's the only Medicare benefit that requires in the law to have volunteers. We built that in there because we felt that it was so important that your participation with our patients, families, and our staff, and the influence you would have to make sure that we kept it humanized, that we didn't over-medicalize it, and that we kept in close touch with each and every one of our patients and family members, that we wanted to write that into the law, and we did. And so we're part of the law. It's required. And I'm really proud of that, because what that says is you all are the most important part of our care delivery model, one of the most important parts. And so again, thank you for all you do. We couldn't do it without you. So back to Rachel to make sure we get our picture taken, right?
Yes, thank you, Tom. And thank you all for turning on your videos. We have like 3 pages of beautiful volunteers. So it's going to take a moment. So let's have everybody look right into your webcam and smile. And then we'll see if maybe Drake and Ashley can tell us when we can stop smiling. So everyone stop making your goofy faces and start smiling. Cheese.
Look at all these smiles. I love it.
It's
I
beautiful.
love it.
Good.
This is so great.
You are all gorgeous and just amazing, amazing people.
One more here. All right, I think we're good.
Oh, and now
Rachel, I want to say one more thing. I see my friend John Lynn on the screen here. John, I wanted to recognize John called the other day and said he wanted to deliver a very sizable contribution for us. And in the midst of COVID, he came out to our headquarters. He met with Kim and delivered something that was quite meaningful. And John, all that you do and the work you do with Hallquist and helping us with that, I just wanted to especially recognize that. I could not believe that you were actually coming out to headquarters in the midst of this pandemic to make sure we got that. So thank you, and of course thank the generous donators who gave that to us as well. So each of you play such an important role. Thank you. Have a happy holidays. Bless you, and we look forward to continuing our work together for our patients and families.
Thank you, Tom. Thank you all. A round of applause to all of you beautiful, wonderful volunteers. Oh, we love you. Happy holidays. Thank you, Tom.
Thank you all. Bye-bye.
Thank you. Bye-bye.